There are people we work with every day at The View that are like family to us, and sometimes, even though we're close to them, we have no idea about the emotional struggles they deal with at home. Our cameraman, who we adore, Manny Gutierrez, has a 2-year-old daughter, Anna, who is diagnosed with Rett syndrome, a debilitating neurological disorder that has left her unable to walk or talk, and he's here today with his wife Stephanie and Anna to share their story. We're really thankful that you guys are here, Manny, that you brought this to our attention, and you know, we want to know more because it's something that's not talked about enough, and we're so thankful that Anna's here with us today. Can you tell us first what Rett syndrome is?
Well, basically, Rett syndrome is a neurological disorder, and it's, if you can imagine, the symptoms of cerebral palsy, epilepsy, Parkinson's, autism, and just an overall developmental delay kind of wrapped up into one little girl. And, and the funny thing is they progress normally for about 6 to 12 months, just like any kid would. Right. And all of a sudden, there's a big regression where you start losing your child. She stops walking. So you would take Anna in for the appointments. And first, is there something that the doctor said causes it? And then what was happening? She was reaching, because they have marks. You go in, they ask you certain questions. Is the baby doing this? Is the baby doing that? Right. You know, we were kind of moving along and figured she'd eventually catch up. There's no specific cause. It's a genetic, sporadic, just genetic mutation. It affects 1 in every 10,000. Mainly girls. Mainly girls. So it's an X chromosome. Yeah, exactly.
Stephanie, when did you first realize that there might be a problem with Anna?
Well, we brought home Anna from the hospital, and we were very excited because she was very healthy. She hit all of her milestones. We rolled over at 4 months, set up at 6 months. She was babbling consistently. And between 6 and 9 months, the milestones she kind of quit meeting them. And when we brought it to medical professionals, they just said, give her time, maybe, you know, she'll catch up eventually. But then by 9 months, she had developed kind of a constant tremor, like you see in like Parkinson pages. She was kind of always tremoring, and she wouldn't roll over as much. Her babbling, she quit talking completely. And then by 12 months, we got really concerned when she would start spacing out on us, and she wouldn't respond to her name anymore. And I think Anna gets upset sometimes when we talk about it. But
so we talk about her not being able to walk or talk, but she can fully understand. Is that right? Everything that's going on?
Yeah, absolutely.
You're just hanging in.
Anna Banana, you're a diva, girl. You're so appropriate.
I love those curls. I love those curls.
She does. We had a huge breakthrough around 18 months after our diagnosis. What Anna understood cognitively. We always spoke to her in a very age-appropriate way, even though we weren't sure what she was taking in and retaining. And the occupational therapist had come over and had done some therapy with her, and she said, Stephanie, you have to come look. And she brought us in, and she said she lifted her legs on command. I told her to lift her legs, and she lifted her legs. And then we realized there's a little girl in there, and she's completely trapped. We knew that she's 2.5 cognitively trapped in this body that can't talk or walk for her.
Is she comfortable right now? Is she in pain or anything?
Would you like Anna to go backstage?
Maybe we should pass her off just to, you know.
She seems unhappy right now.
So yeah. More comfortable.
Well, this is a lot to take in, even for us.
It's a lot of sensory overload as well.
Yeah. And Manny, you're always so cheerful around, you know. I mean, you have to keep your spirits up because this is a heavy,
it's a
heavy
lot.
thing. How do you keep yourself, you know, both of you, from not going under?
Well, I could make a joke there, but yeah, right. I think humor and faith get us through the worst of days. When we were doing genetic testing, trying to figure out why she wasn't talking anymore, why she wasn't crawling, why she wasn't sitting up anymore, the geneticist said to us, and she had had a seizure by then. And he said, we're going to start with the worst case scenario. We're going to start with Rett syndrome, and we're going to work our way down. And 3 weeks later, we got the call telling us that it was Rett. And we didn't think of our daughter as a worst-case scenario. We thought, I know Manny spoke.
She was so, like, she was just moving along. We felt like we were going to make progress. We got involved with therapies. You know, she was getting help. And we were just going to get past this, that one day it was just going to be over.
We were going to be able to protect her from the worst of the worst.
What is the prognosis?
As it stands right now, imagine, if you will, like an adult whose like hands are tied behind their back and tape over their mouth.
No,
inside.
And so she needs 24-hour care.
Right.
Is she, would stem cell, stem cell help her or something? Some of these new things that they're doing with
Well,
that.
they actually, Rett syndrome was the first neurological brain disorder ever reversed in a laboratory mouse, and that showed us that it wasn't a degenerative disease, that it just needed a protein to get those neurons firing again, and we have, and I think that's what gets us through the hardest days. You had asked that we know that there's a cure coming. We know that there's hope for it, and we know that science says that this can be cured.
Right.
And
So what? Oh, I'm sorry. Oh, so what can we do? What should are there organizations we should be trying to help out? Because this seems, you say 1 in a trillion, but you never know who that 1 in a trillion is going to be. So what can we do to help?
Well, I think for one, just being informed about Rett syndrome, getting on the web, looking it up, finding out what it is, and especially for people out there who are having children who just not all the questions are answered for their child, where they don't really fit in cerebral palsy, or they don't really fit in autism.
But they've been given this diagnosis.
To go to their doctors and get genetic testing.
It's a simple
and then
blood test.
Also, to look up, certain foundations like the Rett Syndrome Research Trust, and really help that private effort to really push the research.
I just really, I want to, with a child like Anna, I know sometimes it can just be overwhelming as a mother, as a father. When you have friends out there, sometimes we're sitting here and we're going, we want to help you personally. What can somebody like us do for you when you just day to day helping you?
It was funny because I was reading in a book. It said, when your child receives a diagnosis of cancer, people bring you dinner and offer to watch your kids for you to get away. When your kid receives a diagnosis like Rett syndrome or autism or something, people kind of don't know what to do, and I think just honestly. Donating to the private researching, to the private research that we know that is driving the force behind the cure.
We actually have someone here, Monica Coonrads, is the executive director of the Rett Syndrome Research Trust, which you mentioned, Manny. And maybe she can give you a glimpse into the future a little bit. Your daughter Chelsea is 14 with Rett syndrome, inspired obviously your involvement in the trust. What does the future hold here, and what can this family expect and other families expect that are kind of going through the same thing?
Well, as you can imagine, I speak to a lot of parents whose children were newly diagnosed and they're full of questions. I wish we had a cure today. We don't. But science tells us that we have every reason to be hopeful. And Stephanie mentioned the reversal in laboratory mice, which was completely unexpected. And so our research focus has changed. It's not about if. It's about how. And we're really exploring every potential avenues.
In terms of treatment, is there a pattern of improvement or lessening of symptoms, or?
Yes, the stage that Anna is in now is oftentimes called kind of a rapidly deteriorating stage where they're going through the regression. And then the children kind of, they don't improve, but they stabilize. And they may stay in this stabilized period for decades. But although it's not considered a neurodegenerative disorder like so many other childhood diseases, having Rett syndrome your whole life certainly does take its toll. So the quality of life is very severely affected.
Is there a support? I mean, or is it through the trust of other families? Did you find a community of other moms and dads out there going through the same thing?
Yeah, and it's probably the most welcoming thing you can do, because something like this leaves you so isolated and so alone that when you start finding these people going through the same thing on a day-to-day basis, it's
How much does medical insurance help you out?
A lot. I mean, we're here in New York, and we get a lot of social programs helping us. And
That's good.
Yeah, never been so happy to pay taxes.
Manny and Stephanie, you are with us every day, and you do so much for us here. But just know, we are with you all every day, and she's beautiful. And there's some good news that we got today, and progress to be made. So we'll work hard at that. Our thanks to Manny, Stephanie, and Anna, and Monica. For more information on Rett syndrome, please check our website. We will be right back. I think that reversal is